The physicians at Resurgens Spine Center share the philosophy that conservative treatment should be offered before considering invasive treatments. 90% of patients will respond to a conservative treatment program that consists usually of medications, physical therapy, home exercise, and using ice and heat. We consider these treatments to be part 1 of a 3-phase treatment program, phase 2 being spinal injections when needed, and phase 3 being surgery if necessary. In many cases, conservative treatment will begin before the diagnosis is confirmed. For instance, you may have radiating arm pain consistent with a herniated disc in the neck, but if your symptoms resolve with conservative treatment, as is usually the case, an MRI scan may not be necessary. There are 3 classes of medications that are often prescribed for spinal conditions: anti-inflammatories, muscle relaxants, and pain relievers. Anti-inflammatories work at the source to reduce pain and inflammation. These medications include Advil, ibuprofen, and Aleve. Steroids are another form of anti-inflammatory medications that can be used. Muscle relaxants actually work in the brain to reduce muscle spasm by relaxing you, and pain relievers work in the brain as well to block the sensation of pain. Tylenol is a very common pain reliever that is used. Some pain relievers and muscle relaxants do have side effects such as sedation, drowsiness, and other side effects. Using ice or heat on the affected area is another effective way of relieving spinal pain. Heat works by reducing muscle spasm and increasing blood flow to the muscles. Ice works by numbing the pain and reducing inflammation. Usually for the first 48 hours after an injury, ice is recommended because it reduces the buildup of inflammation and pain. After 48 hours, heat and ice can be alternated, heat to reduce the muscle spasm and ice to reduce numbness and inflammation and pain. Physical therapy is one of the most important components of a conservative treatment program. 90% of patients with degenerative conditions of the spine will respond to a program of frequent back or neck stretching and strengthening exercises. The physical therapists at Resurgens are trained to recognize a patient's unique needs and develop a program specifically tailored for their condition. Surgeons physiatrists are medical doctors that specialize in non-surgical treatment of spine and other musculoskeletal disorders. If you and your surgeon or physiatrist have determined that you are not adequately responding to a conservative treatment program, you may be offered spinal injections, which are performed by our physiatrist. This treatment is considered to be phase 2 of the 3-step comprehensive treatment program. These injections often include epidural steroid injections. An epidural steroid injection is an injection of cortisone that goes into the spinal canal to alleviate pain and inflammation often caused by stenosis or other degenerative conditions. The injection is done under X-ray guidance to guide the needle into its proper position once the skin and muscle tissue has been anesthetized. Once the needle is in position, the steroid medicine is injected and the needle is removed. Patients can resume their normal activities afterwards, and typically your physician will want to see you 2 to 3 weeks after the injection to determine if it has been effective. Oftentimes the injections can be repeated, and we can do up to 3 or 4 within a 1-year period. Many patients want to know whether the injection is merely masking their pain or prolonging the need for surgery. In many cases, an injection can provide enough relief to delay or prevent the need for a surgical procedure. Resurgens board-certified orthopedic spine surgeons strive to provide comprehensive care for your condition, focusing first on non-surgical treatments. When conservative treatment has failed, our surgeons are expertly trained to perform the latest surgical techniques and utilize the most recent technological advancements in spine surgery. One of these advancements is minimally invasive spine surgery. Our surgeons perform surgical microdiscectomies, minimally invasive spinal fusion, and endoscopic laser surgical discectomy. Endoscopic lumbar discectomy is a surgical technique used to treat certain types of disc herniations. During an endoscopic discectomy, a small tube about the diameter of a pencil will be inserted into the disc from a small skin incision less than 1 centimeter long. Once that tube is inserted into the disc, a small fiber optic camera will be inserted through the tube into the disc, and the surgery will be viewed on a video monitor. Small instruments are then inserted through the tube into the disc to remove herniated material. Sometimes a laser is used to remove abnormal tissue as well. Once the disc herniation has been removed, the tube is removed and the incision is covered with a Band-Aid. The surgery is done with the patient awake and the patient goes home the same day. The surgery usually takes less than an hour. Not all disc herniations can be treated with this technology, but for many patients it is a very good option. Another state-of-the-art procedure performed by our surgeons here at Resurgens is lumbar and cervical artificial disc replacement. This is a surgical technique used to treat disorders of the neck and low back. In the past, when patients had severe radiating arm pain from a herniated disc in the neck or severe debilitating back pain from a degenerative lumbar disc, the only surgical option was to remove the disc and fuse the 2 vertebrae together. Many patients still undergo spinal fusion, and it can result in dramatic relief of pain. However, the fusion does result in loss of motion at that level, which can transfer some of that motion and stress to the discs above and below the fusion. An alternative to the fusion is artificial disc replacement. With an artificial disc replacement surgery, the disc is removed, but the disc is replaced with a mobile prosthesis, which allows for flexion and extension and rotation. This usually results in quicker return to function and quicker recovery, and hopefully in the future will lead to lower rates of reoperation at the other discs. 2 of our surgeons serve as faculty for the companies that produce these discs, teaching other surgeons throughout the United States how to perform these technologically advanced surgeries. Up until now, the FDA has compared these artificial disc replacement devices to fusion to determine their safety and effectiveness. Currently, Resurgens is enrolling patients in a new FDA study, which will compare one of the currently available devices to a new artificial disc replacement, which allows not only for motion, but also for some cushioning effect for the spine. This is considered to be a second-generation artificial disc replacement. Regardless of your condition, from simple disc herniation to complex spinal deformity, our board-certified spine surgeons are here to provide you with the most advanced care possible. After surgery, the Resurgens Spine Center team will work together to coordinate your rapid rehabilitation and return to function. Our goal at Resurgens is to restore your health, energize your life, and get you back in motion as quickly as possible.